Ontario's hearing instrument specialists say proposed changes to the way hearing aids are dispensed under the province's Assistive Device Program is going to create more barriers for people to access the vital hearing care they need.
So what would normally happen is someone would come in for a hearing assessment. They'd be seen by an audiologist or a hearing instrument specialist. They would have the hearing test done. We'd go over recommendations for hearing aids if applicable. And then we go into the grant process.
Chris Arnold, president of the Association of Hearing Instrument Practitioners of Ontario, explains that the grant under the province's Assistive Devices Program, or ADP, covers $500 per hearing aid every 3 to 5 years for those with an Ontario health card. Access to the grant can currently be authorized by a hearing instrument specialist, audiologist, or speech-language pathologist who assesses the patient. The form must also be signed by a prescriber,
which would either be an audiologist that's not financially related to the authorizer or a physician.
On January 24th, the Ministry of Health's Assistive Devices Program initially sent out a memo stating that ADP grants can now only be authorized by audiologists or speech-language pathologists, specifying that they are regulated professionals, and removing hearing instrument specialists who are unregulated from the role. They also removed physicians as prescribers on the grant form.
However, in Ontario, everyone needs to get a prescription regardless when dispensing hearing aids.
Only audiologists or physicians can provide that prescription. But as Arnold mentioned, the audiologist prescribing the hearing aid cannot be financially related to the authorizer who assesses the patient. So the authorizing audiologist would still need to contact another audiologist to sign off or get a physician to sign a separate prescription.
It's going to cause a giant logjam of waiting times and even remove access for a lot of people.
With a total of just 933 audiologists in Ontario, Arnold says if the changes were to go through, there will be a major disruption in the hearing care sector, and it could lead to various detrimental health impacts for Ontarians.
If they're in remote areas where there might be only a hearing instrument specialist in that area and there's no audiologist for 100 kilometers, I don't know what the option is for them. This could cause them to put off getting treatment, and as longer and longer you put the treatment off, can lead to other comorbidities, stroke, hearing loss. There's even been some studies that possibly dementia, and it could lead to issues with the brain, with the heart. So therefore, with all these things, it could increase hospital visits. It could increase major health concerns outside of hearing.
Now, after these concerns were raised, the ministry has pressed pause on some of the changes, but Arnold says there's still a lot of gray areas. We'll have more on that coming up.